Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hello. Happy Q&A day.
Good morning.
Good morning, everyone.
Yeah, we can go to our first question.
Hi there. I'm like 90 days post-concussion and I'm having severe difficulty with like working memory, finding words, remembering questions, following a story. I'm just wondering like how long that usually takes to go away and if there's anything I can do to speed up the process.
I like it. Nice and concise.
Thank you.
Yeah, so how long does it last? It really depends. Like all of the symptoms that you experience are due to some dysfunctions. However long it lasts is how long does it take us to get rid of those dysfunctions and identify the ones that are driving it. So cognitive function is so multifactorial. And so it really involves kind of going through the process and identifying or at least working on each of the potential drivers of that. So like, for example, I know you probably aren't in the, how long have you been in the program?
Just recently, I think I joined about less than a week ago.
Yeah. So obviously there's a lot that needs to be done to help figure that out. But if I just show you, like if I get to cognitive function, I'm going to share my screen. Can you see that?
Yes.
So, and this isn't even everything, but like cognitive function is associated with stress, anxiety, depression, PTSD. And actually most of the research shows that people with persistent concussion symptoms tend to report cognitive problems quite frequently. However, when they're actually tested on objective neurocognitive evaluations, most people actually test normal. And the highest kind of association with people who report cognitive issues tends to be people that score higher on anxiety and depression. So the more anxious you are, the more your mind is kind of swirling and ruminating, the less clear you can think. And so that's going to trip you up in trying to kind of formulate thoughts and pay attention to things that are going on because your mind is actively kind of swirling around other things. Other potential contributors, if you're in pain, hard to focus, right? So other types of physical symptoms, pain, dizziness, headaches, all that stuff makes cognitive function very difficult to process. Autonomic function, so your autonomic nervous system, right? Fight or flight versus rest and digest. If you're stuck in a fight or flight, it's very hard to kind of keep things calm, and that also controls blood flow to your brain. So if you're in a sympathetic state, you can't properly modulate that blood flow to the brain, and that can make cognitive function impaired. Inflammation, right? If we have a lot of chronic inflammation, gut issues, sleep issues, all of that stuff is tied to inflammation. That can make cognitive problems worse. Energy, food, diet, the way you're sleeping, any medications you might be on, all of these impact cognitive function. So we can't look at cognitive function in isolation. And many people think that, well, I have a cognitive problem, therefore I should be going to cognitive rehabilitation. But actually, the way that it should probably be more so looked at is that should be the last, very last step, even beyond rehab. So if we look at the concussion recovery pyramid that we have, right, we have rehab at the very top of that. And then even at the very tip of that would be cognitive rehab. And the reason is because cognitive function is so tied to all these other systems that going and trying to do cognitive rehab before you've actually addressed those systems is kind of just a waste of time. Because generally what we see is that once we fix all the other systems and symptoms, the cognitive function restores on its own.
Oh, okay.
Right?
Interesting.
So don't worry too much about the cognitive piece. If your early days in the program, just keep going through and try to address all the things, and be sure not to skip over Melinda's section, because that's usually the biggest driver, is that whole mindset piece.
Mm-hmm. Okay, perfect. Thank you.
Does that make sense? Anyone else have anything to add? Melinda, Paul? Okay.
No, you absolutely hit the nail on the head there. So I was just going to say,
Yeah,
cognitive is the biggest thing that often I find is related to people's anxiety, depression, and oftentimes the one thing I'll say, people don't like admitting that they have maybe some of those issues. But I think if you're just brand new to the program, it would be just really, really great just to kind of slowly work through, especially in a section. And you might notice that even though you may not be directly addressing quote unquote cognitive rehab, a lot of those symptoms may just resolve in the next couple of weeks as you implement everything.
Yeah, cognitive function is more of like a sign of dysfunction than an actual issue in its own. And so if you clear up the dysfunction, now your brain can work better, right? If you're not chronically inflamed, if you're not stuck in fight or flight, if you're not in this rumination kind of anxiety spiral, if your sleep is good. So that's all the things we work on in this program. Is we're not going after individual symptoms. We try to fix the systems that cause the symptoms. And so each of those threads, and every person is going to be different, right? For some people, the mindfulness side may not do much for them, but once they get to diet, all of a sudden that starts to really improve things. And some people, it's when they get to even neck function can influence your cognitive function. So it just depends on what the issue is for you, but it's really important to really take your time and implement each step in the process, because you'll find one of those will be, let's say one of them will knock off 20%, then another one will knock off another 20%. And then before you know it, you're like, oh, I'm thinking clearly and able to function properly.
Okay, great. Thank you.
You're welcome. All right.
So I actually had a couple of questions, but I'll just maybe give one question just to allow everybody else to talk before I do my second one. So one of the weird symptoms I've been having really since I had a concussion a couple of months ago, since my fall about 2.5 months ago, is I've been having a lot of weakness, like muscle weakness, and it feels like motor impairment or motor activation delays. That's the best way I can describe it, whether it's kind of speech or even just like, and it flares up more in the morning. So if I'm getting up early in the morning, and especially on the days where I have to get up and drop get my son ready and drop him off at school, it's like as soon as I get up, I'm okay. And then a few minutes in, I start just feeling like everything feels like it's a lot of energy just to like even move my arm, just to like do any action. And then probably after about an hour, a couple of hours, it feels like it starts to resolve a little bit. But I was just curious if that's something that is, that is part of some of the dysfunction with this, because I feel like I haven't really heard of motor issues or weakness necessarily being a prominent symptom, but just curious, any thoughts on that?
It's not usually.
Mm-hmm.
Have you had a neurological evaluation? Like anyone checked your reflexes and your motor strength?
Yes, I've had that. I've had the MRI. I've done all of those things, and nothing has come up.
And have you described this symptom to your healthcare provider? Have they done any further evaluation on this?
No, not really. I mean, basically, I think the last time I spoke with him a few days ago, my neurologist she just recommended maybe I go to like the long COVID clinic to potentially see if it's fatigue, like chronic fatigue or something. But no, there's really no other guidance I've gotten. I don't think anyone really kind of knows what's going on. And I mean, but she's ruled out anything related to neurodegenerative or any of that. But
Perfect.
no, I don't know.
Yeah, so that's the first step, right? That's why I asked those questions, because you want to make sure there's nothing else going on, right? Like a lot of time, like other conditions can cause that. And so a lot of times, like, okay, a concussion happens, but then also there's something under the surface, right? Like somebody also potentially has MS or something like that that can cause that type of symptom profile. And they're attributing it to concussion, but there's something else going on that has nothing to do with concussion, but the link has been made just because of the temporal kind of proximity to those two things. So as long as that stuff's been ruled out, then that's okay. That's step one. Then it's going, okay, what else could be potentially driving that? Like this could be, I don't know, Paul, what do you think? Like a sleep quality issue, like maybe your sleep is not great, even though you're maybe getting enough sleep from a time perspective, maybe the quality of that sleep is impaired. There could be other factors that are kind of contributing to that. It could be like, what's your exercise routine look like? Like, are you becoming deconditioned?
No, I'm doing treadmill about 25 minutes. I either go walking outside or I do the treadmill about 25 minutes every day. And then, I will say that like the days where I'm not, where I'm not having to rush and get my son ready and then think about taking him to school and all, I do feel a little bit better because I can sleep in a little more. Maybe that stress isn't there. And the only other thing I'll mention is like usually the day before, for example, I have gone to work full time, with the cognitive load and all. And I think over the course of the day, I start to, if I do like more screen time in the late afternoon or whatever, I start to feel it's almost like an acute, like laryngeal reflux type, where I feel the tightness. I start feeling shallow, like my breathing feels impaired, and then I feel some anxiety. Like I just feel that anxiety feeling when I'm going to bed, and that and then I don't sleep well, and then I might start having the flare up, more of that weakness flare up in the morning when that cycle kind of happens. So I don't know if it's again something related to gut or inflammation or just like stress. But it's weird because it didn't really happen before the concussion. I mean, this kind of generalized weakness. So
yeah, but that's the thing with concussion, though, right? Like it really just like starts to dysregulate a bunch of different things, right? So it's probably related to the concussion injury, and now it's trying to figure out like what mechanisms are causing those types of symptoms, right? It could be stress and anxiety, and that sends you into a bit of a fight or flight, which then kind of makes everything not function as well. It could be something related to that. I don't know, Paul, Melinda, do you guys have any thoughts on this?
Yeah, I mean, the symptoms really are suggestive, as you said, to a stress response. And to give that a little bit more color, that is, if you're getting that kind of like reflux, you're getting that kind of globus sensation in your throat. That often is a stress response that is related again to our brain via the vagus nerve or the dysfunction of the vagus nerve interacting with abdominal and thoracic organs. And functions. So I don't know if you've gotten to that section in the course, but implementing some of the vagus nerve exercises. Melinda talks about it. I talk about it in the gut brain section, because that's one of the windows that we have to be able to have an anti-inflammatory effect, a calming effect, using a very physical type of function. Like last week, Dr. Cam talked about humming and using kind of like your soft palate in your throat to activate the vagus nerve. In the course, I talk about slow, deep diaphragmatic breathing and a bunch of other things like gargling that are just simple, easy, free things you can do at home to regulate your nervous system. And that's a good place to start.
Yeah, I wonder if it could be the vagus nerve. I'm not at that section yet. I just finished the recovery mindset and now I'm on the sleep.
You're close. You're like one away. So you're like
the nervous system regulation might be a place to sort of just stay for a while, get to know those components, have a better understanding. What you're going to learn there too is when we all of us have a window of tolerance, specifically after injury. Your window of tolerance to stress can really reduce. It also is an emotional window of tolerance. So we're having a hard time regulating our emotions at times, or regulating our stress. So what you might learn there is that it's not just like anxiety isn't always just high energy. It can also be really low energy. And I wouldn't exclude weakness from that. So sometimes when we get bumped below our window of tolerance, we can also feel really lethargic, shut down, numb, low. So you might think about, what's my mood like when I go into this low energy mode? Maybe there's a connection there, but I would just sort of take your time going through the nervous system regulation module, and there's several lessons in there, and it may just be, trying a few things and then checking in with how that symptom is and seeing if there's a connection. Sometimes it takes a while to figure it out, but I think you're into a good place in the program for the concern that you have.
Okay, thank you.
You're welcome.
All right, can you hear me?
We can.
Okay, great. Yeah, so I'm curious. I've been taking magnesium glycinate at night. I now take 200 milligrams. I was taking 400, but I've noticed that even at the lower dose, I feel groggy in the morning. So I wonder if you had any recommendation for what to do about that.
Yeah, it's actually we've heard this question before. I've seen it with my patients. It's not a common, I guess, effect of magnesium. So it could be a couple things here. Number one, consider that maybe it's the glycinate, because the magnesium is the one component of that combination, because magnesium is attached to this other molecule, this other compound. In this case, it's an amino acid called glycine. And so sometimes glycine on it by itself, it has a very calming effect. And so, trying magnesium citrate, for example, might be a way of just kind of teasing those two out. So that's one possibility. Have you tried any other forms of magnesium before I give you my next possible?
No, but was there one that started with a T that you recommended? Should I try that one?
Yeah, so that's threonate. So threonate definitely gets into the central nervous system. It seems like, based on the research, a little bit better. But I would probably go without the threonate just to see if we can use more of kind of a generic magnesium. The threonate is just like even a better version of glycinate. So glycinate will eventually turn into threonate down the line. It just gets past the blood-brain barrier better. So maybe try citrate. Some kind of more foundational or kind of a little bit more muscular based one. So that's I would say citrate's probably the most accessible. If you make even things like a powder like calm magnesium, it's a really common one. Start with a very low dose. The second possibility is that you just might be a hypersensitivity person to magnesium. So there's a group of people that take magnesium and they literally get the opposite effect of what they should have. So they're kind of getting like stimulated. They get these effects that are, opposite of what they read online. They're not calm. If you're getting kind of the groggy piece, again, that could be part of that picture where you're just having the effect that is like too much of a good thing almost. Those people need to use other electrolytes, so like potassium and taurine, which helps the electrolytes do their job better, and B vitamins. So making sure that they take kind of like the full spectrum of nutrients that magnesium needs to properly function. And then I think you're doing the right thing by playing around with the dose. Sometimes they need to take the dose before bed. Sometimes they need to take it in the morning, and they notice they feel a lot better when they kind of switch things up. So it's a bit of trial and error, Liza, but that's really the way to figure it out.
Okay, and then I'm trying to figure out a good pillow. I'm sure this has been asked before. I have a pretty small frame, so a lot of the pillows that are designed for concussion recovery, I feel like they do have the curve, but it's kind of like it's a little bit too tall of a pillow. But I'm wondering if you had any recommendations for a brand or style of pillow.
No, it's really personal preference, to be honest. If you find those ones are too tall, you just try to find one that's a little smaller, try that. It's a lot of trial and error, trying different things.
I imagine down isn't a good option.
I mean, like I said, I'm not big on like specific, it has to be this way, because everyone is so different, and what you like and what gives you the most comfort in sleep is going to be different from somebody else, right? Like the whole idea behind, pillows and things like that is to just keep the curvature of the neck, really. But it depends, like side sleeper, back sleeper, tummy sleeper, everyone sleeps different. And a lot of people move around in their sleep. And so a pillow that works well in one position is not going to work well in another position. And so it has to come down to personal preference.
Okay. Um, and then I've been going to craniosacral, which has been really helpful. She, because I have visual issues, and she asked me, this is sort of just like something I'm interested by. Like she asked me if, when I was a baby, if I didn't have a lot of time on my stomach. She called it tummy time.
Mm-hmm.
I'm just curious if like you found in your research, if you've if that's come up. Like I have had visual issues my whole life with like light sensitivity, difficulty focusing on things. Like if I'm in a big store, eye tracking with reading, and then it's just gotten worse with my concussion. Obviously, I don't want to dwell on it, but I'm just curious, like if that's come up, like babies without a lot of tummy time. If you've like heard anything about that affecting vision, and like then maybe made worse in concussion.
I haven't, but this is not something that I really dive into a ton of the research on, like developmental stuff. I don't know, Paul, Melinda, if you've seen anything on this type of stuff.
Unfortunately not. I don't have any other insight on that. I know, like, because obviously we have lots of kids, as people know. So I've heard a lot of things. We've seen a lot of different providers, but again, I don't have personal experience with it, so I can't actually speak to that particular piece. I know osteos and craniosacrals, people that work on that myofascial, especially when they kind of take that like neurodevelopmental perspective, they sometimes come up with these observations, but that's not something that's my area of expertise at all.
Yeah, me neither. I know, with my own kiddo, they really encourage tummy time, but beyond sort of what the mechanisms are or the reasoning, I'm not quite clear. I mean, it's hard. Everybody has their different areas of expertise and something different they offer you, and it's hard to know whether or not, that's exactly what's happening, but something just to keep doing your own research for, and maybe something will click. Um,
Yeah, she recommended. Oh, sorry. She recommended, like, it's kind of funny, but spending more time on my stomach. She said, like, play with your dog and, crawl around a little bit. So I don't know. I mean, that can't hurt, right? Just to kind of like spend more time on the ground, like, might be kind of grounding for me. I don't know.
That part I can speak to, absolutely, right? That sense of just spending time on the floor is very grounding, especially if you can be outside, that can be really helpful as well. So something to think about, just that's why, yoga is so promoted, and yin yoga, tai chi, right? Making those connections to the earth and really feeling grounded in your feet and in your body, that's all very helpful.
Okay, and then I just have one last question. Do you have a recommendation for a type of prebiotic, probiotic, and like, will that help much with recovery?
We actually tackle that a lot in the supplement section. So we do talk about the benefits of both prebiotics, they do have some research, again, correcting that gut brain axis in the gut lining is important role to regulate inflammation. But actually, we just launched a members perk section in the actual course itself. You can go on the left side. There's a menu. You can click on it, and then you can pick a whole bunch of different supplements that we kind of allow people to see what some of the most evidence based and I would say preferred things that people can order. We actually have not put a probiotic in there. Because again, probiotics, there's so many different ones for so many different reasons that you'd want to use. There isn't, like, at this point in time, the research isn't good enough to say, here's the perfect gut brain axis strain yet. So I think hopefully the research will be out shortly on that. So we don't have a particular recommendation, unfortunately, but find one that you tolerate well, that has usually a good rule of thumb is about at least 20 billion probiotic, combination of lactobacilli and also bifidobacter. So there's a combination of both of those.
Okay, thanks. Sorry, I just thought of one more thing, if that's okay.
So go for
Yeah,
it.
I saw. Okay. Yeah. So I I don't have pain in my neck. I just have jaw tension. sh- I have found somebody who specializes in ART, so I was going to see them. But I was wondering, like, should I still be seeing this person if I don't have pain?
Yeah, I think a lot of times I'll see patients and the only issue they have is like a visual problem. They don't have any neck pain at all. They don't have any headaches, or maybe they have headaches. Maybe they have some TMJ issues, but they don't have any neck pain. And then people assume, well, then it's not a neck problem. And that's really not the case. Because oftentimes pain that's really significant doesn't appear as neck pain. It'll appear as head pain or other types of pain, even though the central area where it's coming from is actually the neck. So I still think it's important to look at it. And TMJ issues are associated with neck dysfunction. And neck dysfunction is also associated with visual issues. And so the only thing I can think of is in associating this idea behind reduced tummy time as an infant and visual problems when you're older is the fact that there's potentially some dysfunction in the neck, right? And the advice from your craniosacral therapist to spend more time on your tummy, the whole idea there is let's strengthen this person's neck, right? There's probably better ways to do that than just spending time on your tummy, but it might be just an easy way to ease into it. So if you have jaw issues, there's a really good chance you have neck issues. And if you have visual issues, there's a really good chance you have neck issues. So you'd want to work on both the TMJ and the neck and the visual system, because all your visual problems might purely be neck related. And I see this all the time. Patients will come in, I have these visual issues, things just look weird, blah, blah, blah. And we'll test their visual function in neutral, but I also will test it in neck torsion. So I'll have them rotate their head as far as they can to the left, and then I'll retest those visual things. And what you'll see is it'll make it worse. And so if that's the case, if I see worsening if they're rotated left, I start thinking, okay, what's getting stretched when they rotate left? And then I will go and loosen off those muscles that are stretched while they rotate left, and then I will retest and see if it improves. Same thing if it's worse going to the right, or looking straight up, or looking straight down. I'll test them in all 4 planes of neck rotation and try to see which one is the worst, and then I will go and address those tissues, and then I will retest. And ultimately, you're trying to get to a balance between side to side, up, down, and then you'll see some of those visual symptoms go away, and then it's actually driven by the neck.
And while I'm going to the ART, I shouldn't be doing too much strengthening, right? I mean, I used to go to the gym, like my concussion was a year and a half ago, and I did go for about 7 or 8 months. But I did stop just to focus on the steady state cardio, but I noticed my shoulders and arms and probably my neck are getting weaker. So I'm not sure if is that bad what I'm doing? Should I still not be like strengthening until I do more of my ART?
So we're talking about 2 different things. One is like upper body strengthening, lifting weights at the gym. The other is like neck rehabilitation, right? So you can still do neck rehabilitation, but usually the first step is doing the soft tissue and like manual therapy work to get things moving properly, and then start to strengthen that. Because if you have neck dysfunction and you start working on actively strengthening your neck, the motor patterns and the movement patterns are going to be abnormal. And so you're just reinforcing a bad movement pattern. So you want to clear that out first, then you want to start strengthening.
Okay, so I'll do some of the like tummy time, the adult tummy time, and the strengthening, I'll do that after some ART session.
Yep.
Okay.
Yep. And especially when you have visual issues, it typically goes manual therapy, then proprioceptive retraining, which is like pairing neck with eye movement. So it's things like looking at a target, turning your head slowly side to side, very slowly. If you go fast, it's vestibular, so you want to go slow, up and down, that type of stuff. Walking with head turns, so you're walking down a street, you look to the left, look to the right, back to the left. You're starting to get your nervous system to learn where things are in space. So that's proprioceptive retraining. Then you move on to like strengthening, right? Okay, this is no longer making me dizzy. Great, my neck function is good. Now I'm going to strengthen to keep it there.
Okay. So the right order for me, I was thinking, is ART. I'm alternating craniosacral with acupuncture. And then after a few weeks of all of this, then I see a neuro optometrist. Does that sound like the right order?
Yeah, there's nothing wrong with that. I would probably, if the assumption is the neck, it depends on what your budget is, really. I mean, ideally, you'd be doing vision therapy and neck therapy simultaneously so that they're working together. If you had to pick one, I would really clean up the neck first and see if the visual problems go away, which in many cases they do. And then you don't need the neurooptometrist.
And the vision therapy is if I'm going to a vestibular clinic, is that
No,
good? 'Cause
no, you need a neurooptometrist.
Okay, so you're just saying instead of waiting for the neuro optometrist, I should be, if I have a good budget, starting that soon.
As long as you have good neck therapy lined up.
Okay.
Because what happens is you're going just to straight vision therapy and you have a dysfunctional neck, you're gonna hit a plateau with vision therapy. Because every time your eyes move and all the rehab exercises they're getting you to do is engaging your neck. And if your neck is dysfunctional, that's probably just going to flare you up, and it's going to hit a point where the vision therapy isn't working because the neck is preventing it from working. So you want to make sure that if you were going to do one thing first, it would be neck first. If you wanted to do vision therapy, that's fine, as long as you are also working on neck simultaneously. Because then they integrate better. Like optimally, you'd be doing them at the same time. But if you were going to pick one to do first, it would be neck.
Okay, optimally once a week, ART once a week, neuro optometry.
Yeah, typically what they do is they'll do a full assessment, and then they'll give you a bunch of exercises to do on your own based on those assessment findings, and then they'll bring you in maybe like once a month. They'll do a follow-up. You know, some people will bring you in more frequently, some a little less frequently. It just depends on who you're seeing.
Okay. Thank you so much. It's really helpful, and I love
You're
the
welcome.
program. Thank you.
Yeah.
All right, we'll move on.
Oh, hi. Well, I have something to say about the visual problems because with this concussion, my visual problems were so bad. Like the beginning, standing or walking was difficult. I always was laying on the floor, and I couldn't read. I couldn't use the computer at all. It took a whole year, once a week, of vision therapy. And I also did neck therapy, but I don't think it helped. I went to a regular chiropractor once a week, and it didn't help. Then I changed to a NUCA chiropractor. That did help, but it is not. And I wanted to say to the other person, I'm still waiting for a neuro-ophthalmology thing. And so this is after a year and a half appointment. So I went to developmental optometrist that did the vision therapy. And what Dr. Marshall was saying about moving your neck, that was, I used to feel so sick. I couldn't even go home without a taxi after. I'd have to stay in their office for maybe a half hour before I was good enough to go home. But the movement, I guess eventually my neck got good enough to take it. So now I can read and use the computer, but it's the only thing is I do get fatigued very easily. And my neck, he's never, although he stabilizes it from the NUCA, well, I'm not sure if he totally does, but it does help. It's never stabilized. And I went to a naturopath last week, and they say they think I have cranial cervical instability. I also have migraines and dizziness all the time. And they want me to take a DMX, digital motion x-ray, and then get percutaneous inflammation of cervical ligaments, injections in Colorado. Each one, they said, like, depending what this DMX would show, costs $20,000, and you might need more than one. And I just wondered what you think of all that.
It's a lot of money.
I know that it's crazy, but I have no life. Like, it's been so reduced, and I had to quit work. I can only a long time. I could only talk to people for 20 minutes, and then I would have to lay down for I'd have crashes up to 36 hours. Before that, I worked. I did guitar. I did, I'd like a regular extra energy bunny. And then after the concussion, no.
So this digital motion x-ray, that's not $20,000, I hope.
No, I could have that done. They said what they think it could be is the alar and transverse ligaments.
Right, yeah.
Are loose. And those. I do have hypermobility throughout my body. And I think it's possible because I had an injury on my ankle from jumping into a pool of water, like when I was young, and it never could be healed. The ligaments were too loose and the foot was too damaged until 2018. They finally had the technology, so I had 3 operations on my right foot. So I do know about ligaments that never come back in my body, so I don't know.
Well, I think Cam, go ahead.
Yeah, so there's a couple things to consider.
Yeah, thank you.
One is that upper cervical chiros tend to focus just on the upper cervical joint. Mm-hmm. But usually there's way more involved in that. They also don't look at all at the soft tissues, like, for example, SCM, deep neck flexors. All of these tissues are typically the ones that impact visual function. And so going to upper cervical, I always say it's only going to be really helpful in about 10% of cases, because 10% of people are the ones that just have this upper cervical dysfunction. Once you fix that, it's done. Most people, it's more global. Right? They have issues all the way down the neck, even into the upper body, the posture, the tightness through the chest that's pulling the spine down. It's more of a, global dysfunction issue. So just going to upper cervical, and this is what people always say, oh, it's not holding. Oh, it's not holding. Oh, it's not holding. Oh, it's not holding. You need to keep coming back in because it's just not holding. The reason it's not holding is because something's pulling it out of place. Well, what's pulling it out of place? Probably some of the muscles that aren't being touched. So that's one thing to consider, is that this is where I don't typically recommend upper cervical for this. I typically recommend something like ART, or somebody who can look at things from a global perspective and realize this is pulling on that, so I'm going to loosen this, and then, that. The other thing is that if there is instability and there is a connective tissue issue, then I think you're talking about prolotherapy injections.
Can I interrupt? They do have a level. So they have physio first, then they have the NUCA, then they have prolotherapy, and then these are like stem cells. So I've never done prolotherapy. I don't know what you think of that. ART, that sounds like a good idea, because I did go to a regular chiropractor for a year before the NUCA, but it didn't.
Were they just doing adjustments, or were they doing soft tissue work like ART stuff too?
He was doing some soft tissue.
Yeah, you need somebody who's like mainly soft tissue.
Okay.
Which is hard to find, especially in the US. Most chiros just adjust, crack.
Okay.
Maybe they'll do some.
Canada. I'm afraid to get it cracked because of this.
Yeah, I wouldn't. Especially if you have like instability, I don't think you necessarily need that. But it's just finding like certain areas, because what happens in instability is that your neck wants to be stable. And the muscles that are really close to the spine are the stabilizing muscles. If those muscles aren't working for whatever reason, right? If certain things are tight, what happens is you actually shut down neural input to those muscles. So let's say the muscles around the spine that are supposed to stabilize it aren't functioning properly. What happens is the muscles that are involved in movement all of a sudden become tight and rigid, because it's your body's way of saying, we need something to stabilize this. So then it starts tightening up other tissues that aren't meant to be tight like that. And they're trying to now fill the gap between the dysfunctional deep muscles and trying to keep things stable. So they'll tighten up. And if all we're doing is just adjusting a joint, periodically, then those muscles are just going to pull that out of place. And that's why I don't typically recommend going the NUCA approach for this. I think it's like 10% of patients will have that benefit. And then you'll see in online forums people like, NUCA, it saved my life, because they're the 10%. And then everyone assumes that, oh, I'm going to go and try this. So I think that there's something being missed. You can notice there's a benefit. So your neck is involved, which is great. But why isn't it staying there? Well, usually it's because something's pulling it out of whack. It could be some postural fault that's deeper down the chain. It could be some tightness in other tissues that are pulling that out that needs to be addressed. And then once you get that addressed, before you start going down the road of injections and all these other things, I would start to work on functionally stabilizing your own neck with proper rehabilitation. Working on those stabilizing muscles to start stabilizing your neck under your own power. If that fails, then you can start looking at the alternatives. You know what I mean?
I think it has failed, because I was doing neck exercise from the physio where I hold my neck perfect with a laser light, and then I try to hold it steady. And I've been practicing that for a year. So I think,
but that's
I've been doing neck strengthening.
Well, that doesn't sound like strengthening. That sounds more like proprioceptive.
Okay, proprioceptive then.
Yeah, you want to be like trying to stabilize it under resistance. So, for example, like a resistance band pulling your head, and you're kind of trying to keep it stable. And then it pulls from this way, and you're trying to keep it stable. You're trying to keep it stable under some sort of resistance. That could be chin tuck exercises like this, right? In a seated position, eventually into like a lying position where you're fighting against gravity. There's kind of a progression that needs to go in terms of strengthening and stabilizing. But I still think there's some dysfunction there that needs to be cleared out first. I'm not sure if you've been getting the right type of treatment.
Maybe I should try this ART, and like, just how long would you suggest it? Because what happens with me, I think I go too long. Like the NUCA, the first time I went, I know it helped me. I know it did, because I could suddenly go from 20 minutes talking to people to long, I could go 3/4 of an hour. So that I know, but I have been wondering if it's doing anything for quite a while, because, it never seems to stabilize. And the first time I went there, he says, if I don't stabilize you in 8 times, I'm not going to. Well, I've been waiting more than 8 times. So I have a tendency to not quit. I just hope, okay, this is going to do it. So ART, how long would I go before I decided, okay, this isn't working? Or it is working and I'm free of all these problems.
Yeah. Well,
yeah.
I think, so I'll just tell you how I do it, right? Because it's really practitioner dependent, because you can go to one person who does ART or claims they do ART, but they're not actually getting to the root cause of the problem. So typically I say like you should notice a difference within 6 to 8 sessions.
Okay.
If you are noticing a difference, it means they're probably on the right track and they can keep going. If you notice now that that difference is starting to plateau, then they need to start either going deeper or finding different tissues to work on to try and keep things moving forward. If you go and it's 6 to 8 weeks and you're noticing no change, there's two possibilities. One is that it's not a soft tissue issue and ART is not going to be helpful for you. Or two, that practitioner is not the right fit.
Yeah.
And this is where it becomes so difficult.
It does, because you waste a whole lot of time. Like I feel I wasted a whole year with the first regular chiropractor because, I mean, with my body, he was good in that he did help me deal with all this, but not actually by fixing me, more just his compassion.
So, I mean, you can go, or where are you at in the program?
Well, I did the old program, and
Okay.
I got right up to the exercise because I have a physio. I still have to do exercises laying down because it just makes symptoms worse if I do it. But I've come to the idea that any movement, slight, which I would not have considered exercise for sure before, but I've come to the conclusion that any exercise is good. So I'm mainly doing that lay down exercises.
And by exercises, do you mean these are like vestibular type exercises, or are these like what are these?
No, they're mainly with my legs, squeezing balls and just putting my legs at a tabletop and then putting them down and up.
Are you doing any type of cardio exercise, walking outside,
I
getting your
do
heart rate up?
walk. I can do that, but it seems every time, like even swimming, that's my best one. But like a lot of times, just going and doing a few lengths, I'll have a crash after, and I have
That could be like swimming. Swimming symptoms with swimming could be due to a few things, right? So it's all about isolating the variables. Like if you get symptomatic with swimming, is it the actual fact that your heart rate is rising and it's an autonomic issue? Or is it the fact that as you turn to breathe, your neck is actually the trigger? And then in which case, swimming is not a good option for you, right? So you just got to isolate the variables, right? So I would suggest if you did the old program, you have access to the new one. I would start the new one and just kind of go through it. We've added a whole bunch of new things there and more information and ways of finding the right practitioner for what you're looking for.
Okay.
I would almost just start over at the start with that. In the meantime, try to look for like an ART provider who's a chiro that looks at things from a global perspective, right? That maybe they are more sports medicine based or something like that. Those typically are the ones
I'm against those because that's who I went the first time, a concussion expert. And anyway, I just thought had been in the wrong spot. I thought it was good when I first heard about it. I thought, sports, that's what I'd like to get back to. This is great. I can go skiing again after I have this.
Yeah, but
it didn't happen.
Okay, let's get back to where do you go from here? I would say start Concussion Fix 2.0.
Yeah.
Do it as if you're coming in blind. You don't know anything. You're going to do every step along the process because you're going to be in a different place now than you were when you first started. But because we think there's obviously a neck component here, I think a digital motion x-ray is probably a decent idea to look at how much instability is actually there. Because it'll tell you whether or not it's there or not. And then I would try to find somebody who does ART and try to look at reviews online, try to find somebody who's really good, go on personal recommendations and those types of things. Try to find somebody who's really, really good at treating necks. And the way to kind of figure this out is if you go to their website and one of the main things they treat is like headache disorders. Because the reason they're good at treating headaches is because they're good at treating necks. So find somebody like that. You start in 6 to 8 sessions, see if that's helping. If it is, great. Then try to find a good PT that can do neck stabilization rehab to try and stabilize it that way first with actual stabilization exercises. And then with that digital motion x-ray, you could go to the PT and say, look, I know I have instability. Here's my digital x-ray results. I need help in stabilizing my neck.
Okay.
Then you do a trial and a course of that. If that is not having an impact, then you can go to the next step, which is looking at things like prolotherapy or whatever other injections you want to try.
Okay.
Okay?
All right. That sounds good. And just the ART, should that be like, because I did for my foot a long time ago, go to one that wasn't a chiro. Should this one be a chiro ART?
It doesn't matter. Like chiros tend to be really good with their hands, which is why, PTs are more exercise based. Most of the people you're going to find on the ART website are going to be chiros or maybe massage therapists.
Okay.
The good thing about a chiro is that they have more training in general. And if there are certain things off with joints, they're probably a better fit for you. But really you want somebody who's good at the soft tissue side to try and work that out.
Okay, thanks so much. That really helped because I sort of like going, oh my goodness, how on earth I would take every bit of my savings to go for this.
Yeah, I wouldn't start with that.
Okay.
Yeah. Okay.
Great. Few questions in the chat. How can I fit these strategies into my day to day, especially meditations without falling asleep, and time for me in the day with family and work? And I think we get this question a lot of people who are working full time or part time, little kids, teenage kids take up just as much time as little kids. But how to fit all these little pieces into the day to day.
Yeah, great question. I replied with a few ideas in the chat, but to expand on that a little bit, sometimes the best way to sort of look at some of these regulation strategies, or if it's mindfulness, somatics, meditation, whatever it is that's resonating for you that you're finding is helpful to regulate your nervous system, it's best to find a time of day when it can be scheduled in. So when you talk about falling asleep, that's likely that the time of day you chose is not a very alert time of day. So in the meditation app, or the meditation lesson in particular, it'll go through different ideas on when's the best time of day, when's the best what's the best space to meditate in. There'll be all sorts of different things to explore. So the general rule of thumb is you want to be alert when you go to engage in a regulation exercise, whether that's a mindfulness exercise, somatics, meditation, self-compassion. That way we're not getting sleepy. Sometimes a side effect of doing some of these practices is to feel sleepy. And if you'd like it to be more of a helping you to go to bed kind of thing, that's fine, right? There's sleep meditations and all sorts of great things out there. But a lot of people don't want to do it in the middle of the day if it makes them feel sleepy. So it might be thinking to yourself, hey, is it first thing when I wake up that I feel best? Maybe I could engage it into these exercises then. Is it later on in the day or after lunch? You can kind of choose the time of day that you might feel most alert and less likely to fall asleep. The second recommendation around the timing thing and when do you fit that in is just starting small. So thinking about 2 to 3 minutes of practice, or 2 to 3 minutes engaging in breath work, grounding, mindfulness or meditation that you can schedule in during your regular daily routine. So for instance, if you're at work and you eat lunch at your desk, perhaps part of that is once you're finished eating, you decide to get up and you do 3 minutes of walking or 3 minutes of movement, right? Mindful walking is a popular one because you can kind of do that at the office, go outside for a few moments, feel your feet against the ground, helping to support your nervous system that way. You may also decide to, listen to a track or do some breath work, but you want to build that into your existing routine. So if you have young kids at home, I'm not sure what the question was around the age of kids, but regardless, is still finding and carving out that time. So for example, if your routine at home in the morning with kids is everybody eats breakfast and then they go get ready. Well, if you're starting to go get ready, it might be maybe I take a mindful shower and I really just focus my full attention on the shower. Or maybe I take a moment where I ask everyone to kind of leave you be, and I mindfully eat my breakfast. Or taking 5 minutes outside of the room where everyone else is in and listening to a track that can support you to regulate your system. Now, it's different for everyone. It really is a lot of trial and error, but there is innumerable ideas. There's so many ideas in the nervous system regulation module this time in the 2.0 course that I would invite you just to try them out and build them into your day-to-day routine. So that's the key message we share in the nervous system regulation module, is really finding a time of day when you can schedule it in and create it so that it fits right into your day-to-day routine. Just like you would eat a meal, have your morning coffee, brush your teeth, right? Making it just part of your essential things that you do is the best way to kind of build a new habit.
Yeah. And especially, like you said, brushing your teeth, take that 30 seconds, 1 minute, and gargle water afterwards, right? So that's where you're finding the little, especially for vagus nerve activation, or when I often hum in the shower. It's something that I've probably done since my early 20s. I have no idea why. It was something that is always done. So like or when I walk my kids to the bus, we hum, something we've always done. So finding those little times is often when I'm chatting with members that, you're already doing something, just tag it.
Add to it. Yeah. Take 3 slow, deep breaths. Feel your breath come into your body and relax on the out breath. Or you can do 3 breaths after you brush your teeth because you're already brushing your teeth, right? It's okay to add that in. It's just building a habit is the hard part. So trying to think of, 1, 2, or 3 things you want to try from the practices that are introduced to you in the program, and then giving them a try by building it into your existing routine.
Great. Question here. What impact does cervical kyphosis have on recovery?
So cervical kyphosis is a flattening of the curve. So your neck should, hold on, let me just so that everyone understands. All right. So I got some images here. Let me find one that's good. And maybe this one. So your neck actually has a curve that goes this way, right? So that's called lordosis. Your mid back, your thoracic spine has a curve that goes the other way. So it's curved forward. That's called kyphosis. And then your lumbar is that way and your sacrum is that way. So you kind of have this alternating thing. Cervical kyphosis is where that curve either flattens or starts to go the other way. Most of the time, it's just a flattened curve. Sometimes on an x-ray, they'll call it like military neck or, whatever. It's kind of like this. So this is a lordosis. This is more of a, I guess I got that backwards. That looks weird. Yeah, kyphosis like this. So lordosis like this. Head is facing this way, right? So the head is facing to the left. I don't know if you're looking at the same thing I am, just in terms of screen mirroring, but the curve is basically going the wrong way or it's flattened. What that typically indicates usually is more so just like rigidity in the neck. So if the neck has a lot of tension, those muscles are going to pull things into this kind of kyphotic position rather than keeping that nice curvature. So how does that impact recovery? Well, it just shows you that there's some neck dysfunction. That's all. And by addressing some of the stuff, like it could be postural issues, right? Your upper back is really curved, everything's leaning forward, and your neck is reacting by, like in that way. So it's just about fixing the dysfunctions, and, you can potentially restore that curvature depending on how long it's been there.
All right, great. One last question, and I did answer it, but when you were talking about finding a good practitioner, someone was asking, because you don't know what a good practitioner is if you've never been to a good practitioner, how to find a good practitioner. And I did put in the chat the 2 seminars that you did back in 2024 about finding manual therapy. Is there anything you wanted to add to that?
No, I think that's your best bet. It's really hard. That's the hardest piece, is finding somebody who's good. So I put a lot of different ways to figure that out in that session, and it's a lot to explain. So I would just recommend you go and watch that session. You'll get a really good understanding of A, what you need, and then B, how to find what you need depending on what your issue is.
Awesome. It's a great spot to wrap it up for today. If you did have any other questions or anything like that, please post them on the newsfeed. Next week, Dr. Hrkal is presenting a seminar, so excited for that. And then we are back to Q&A in 2 weeks. So if you do have any other questions, please come back in 2 weeks or post on the newsfeed. Otherwise, hope everyone has a fantastic day. Bye.
Bye, everyone.
Bye-bye.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.